Today we're talking about premature delivery and medical transport. If you have questions, you can send them to the doctors at WLBT.com. Joining us today is Dr. Michael Livingston with Baptist Health Systems. Thank you so much. Is this a new program that we have at Baptist, the medical transport for pregnant women?
No, it was a program that we had from 1999 to 2006. It resolved because of a health issue with a physician, but we've started it back again.
And this is a really crucial unit for pregnant women who are in danger of delivering early and possibly even losing their babies, right?
That's correct. It is.
I mean, what type of patients would you see there?
We would see patients that are at risk for preterm delivery, patients having problems, twins, triplets that are remote from term that are having issues, patients with spontaneous rupture of the fetal membranes, patients with bleeding issues, remote from term, patients who have medical conditions that their hypertension or diabetes or renal disease not well controlled.
Obviously, there's a need for this.
Yes,
you see these women every day that have these kind of issues. You just don't think of people having, you know, a need for this. You just think everybody has a healthy pregnancy, but that's not the case.
That's not the case. Mississippi is #1 in the nation for preterm delivery. The national average is 12.6%. Mississippi has an 18.8%. 10 years ago was 15.3%, still above national average. So that's something we don't want to be #1 in the nation in preterm birth rate.
So does your unit stay pretty full?
Our unit does stay pretty full, and we're excited that we're starting this program again.
Well, I mean, what are the outcomes? I mean, what are you able to offer these women that other hospitals aren't? Are you actually helping these women go to term with their babies?
We are getting them close to term, if not term. Our unit, Baptist Hospital, is unique. It's the only hospital, only private hospital in the state of Mississippi that has a level 3 newborn intensive care unit and perinatologists on staff. No other private hospital in the state of Mississippi has that. So with that in place, we can take patients from all over the state and surrounding areas where mothers are having complications or at risk for preterm delivery and bring them to our hospitals.
And hang them upside down. You know, that's what they do to you.
Is that true?
Yes, isn't it true?
Really do that?
Well, don't you?
Not exactly.
Well, not exactly. I mean, not like a rack of meat or anything. I mean, but they actually do tip the bed, and you're upside down,
true.
sort of.
Yeah, you are.
Because I know I was in the hospital a little while with one of mine, and somebody said, "Oh, you're in good shape. You ought to see the lady next door. She is completely strung up."
Wow.
I mean, that's what they do, just to keep you from.
I always heard that.
To keep all the pressure off of your the bottom
off the
part.
cervix.
Yeah. I mean, they just kind of turn you upside down.
Makes sense. Well, we've actually got a couple of other questions that are along that same lines. This viewer, Lawanda, says, what are the effects of having your uterus frozen, and are there any long-term effects? I've never heard of having a frozen uterus.
She's talking about cryosurgery.
Oh, okay.
She's having her cervix has dysplasia, which is a virus that causes abnormal pap smears.
Okay.
And so she probably had cryosurgery. Now, cryosurgery, there are studies that show that cryosurgery can cause problems in pregnancy where they don't dilate.
Really?
From that, yeah.
So C-section city, huh?
So would there be any long-term effects to having your uterus frozen?
Not long-term, but if she's contemplating pregnancy, that wouldn't be my first choice.
Okay. So keep consulting with her OB/GYN on that.
Yes.
Okay, here's another one. Great question. My period is at different times every month, and when I have it, I have like a black period at first, then blood. Is this normal?
She should come to see me.
Okay, well, tell us where to find you.
I'm at Baptist, the Colonnades, 501 Marshall Street. My suite is 406, phone number 601-968-0985.
Now, it does change color after you have a child, correct? Because I remember, you know, when your body's trying to flush all that, there's a point when it changes color.
Yeah.
And it gets back to a normal, healthy red.
Okay. So I never thought about that, but if you see a change in color, you need to talk to your OB/GYN.
And you're not pregnant or just had a child.
Right.
All right.
Okay.
Dr. Michael Livingston with Baptist Health Systems, thank you so much for joining us, and thank you for providing this service to women who want to keep their babies in the oven just a little bit longer.
Okay, thank you.
All right.
Thanks for having me.
And of course, for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.